testosterone is a hormone, right? And to have hormonal health, you have to have all the hormones in balance. And for people with type 1, because of insulin's interaction with all the other hormones in the body, it is both complicated on the front end until you can figure out your way and find your pattern. And then it gets really complicated on the back end because as women go through menopause, they have huge metabolic shifts. And so it gets very complicated for the perimenopausal, menopausal type 1 diabetic.
Welcome to the Type 1 and Midlife podcast. My name is Melissa Slemp, a certified nutritional health coach and the founder and CEO of Abundant Health with Melissa, where I help women with type 1 diabetes to feel more empowered and live their best life despite their diagnosis. Each week, I will bring conversations and strategies from guest experts and my experience living with type 1 for over 40 years now. So if you're a woman ready to redefine how diabetes can look and feel for you, then the Type 1 and Midlife podcast is the show for you. Well, welcome to today's episode. I'm so excited to share Dr. Jenn Simmons with you. She is a former top breast surgeon turned functional medicine advocate, and her experience with breast cancer led her to embrace holistic health and establish her business, Real Health MD. Dr. Simmons shares insights into functional medicine and discusses traditional approaches and limitations, and highlights the link between metabolic health and breast well-being. Join us for a dive into breast cancer prevention, alternative approaches to mammograms, and the role of education in women's health. And don't miss Dr. Simmons. She's got a free giveaway for all of you listeners today, offering valuable resources for your journey to breast health as well. Topics include Dr. Simmons' breast cancer journey, her shift to functional medicine, challenges for type 1 diabetics, and discussions on breast cancer prevention, hormone imbalances, and holistic well-being. Dr. Simmons stresses the importance of movement, sleep, and toxin reduction, promoting self-reflection and purposeful living. Tune in today for a wealth of tips on maintaining optimal breast health. And be sure to share this episode with this amazing topic and conversation that needs to be heard by all women. Enjoy and let us know what you think. Nothing you hear on this Type 1 and Midlife podcast should be a substitute for professional medical advice. Please always consult your doctor before changing your diet, insulin dosages, or healthcare plan. Well, hello and welcome. I'm really excited to have Dr. Jenn Simmons with me this morning. Welcome.
Thank you. I'm so happy to be here.
Yeah, I was mentioning to you that I have been following you for a bit now, and I know a little bit about you, and I've heard you on your own podcast and guesting on other podcasts. But if you could just share with our listeners a little bit about yourself. I know your path with breast cancer and breast cancer health is so important to you. But functional medicine, which is a big part of how I live with type 1 diabetes and how I like to coach as well, is it's the most important part, I believe. So if you could just kind of unpack that for us.
I couldn't agree more. And it's interesting because I was on another podcast yesterday and they said, what would you tell your younger self? Right. And
question.
So I'm gonna back up to that younger self who was bright-eyed and bushy-tailed and had the same mission that I have today, but got on the wrong course. And so I really don't remember a time in my life where I didn't know about breast cancer. It's been part of the fabric of my family. And growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She wrote 54 hits in all, and her most famous song was The Greatest Love of All. So she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali, but it really received its acclaim in March of 1986 when Whitney Houston released that song to the world.
Mm-hmm.
And at that time, it would spend 14 weeks at the top of the charts. Only my cousin would never know because she died of metastatic breast cancer, like all the other women in my family, 1 month after Whitney released that song.
Wow.
I was 16 years old and my hero died.
Mm.
And her life and ultimately her death gave birth to my life's purpose because I never wanted another woman, another family, another community to have to suffer like mine suffered. And I did the only thing I knew how to do. I became a doctor. So I'm the first doctor in my family. And not only do I become a doctor, but I become a surgeon and I become the first fellowship trained breast surgeon in Philadelphia. Say that 5 times fast.
Yeah, right.
And I did that for a really long time. I did it long enough for my aunt to be diagnosed. I did it long enough for my mother to be diagnosed. And I did it really well. And I did it so well that I did it at the expense of everything else in my life. And while I thought I was being a good surgeon and being a good administrator of the cancer program at my hospital, and being a wife and a mother and an athlete and a philanthropist and a friend and all these other hats that I'm wearing. And I was probably one of the most high performing humans you've ever known. And I went from being that to not being able to walk across the room because I didn't have the breath in my body over a course of a week. And so I went and I underwent a 3-day, really intensive workup because, when you don't have your health, there's no other choice but to submerge yourself in our system.
Mm-hmm.
And 3 days later, I find myself in the office of my friend and colleague and physician. And he tells me that I need surgery and chemo radiation. And what I have is not curable and that I'm going to be on lifelong medication. And believe me, I appreciated the irony. These are words that I delivered all day, every day, without hesitation or reservation. And yet, when those words were coming at me, I just knew that there had to be some other solution. And I refused treatment. I left the office that day with the same warning that I had given thousands of women before, which is what will happen if I don't treat this? And he told me I'm going to die of my disease. And it's not that I didn't believe him, because at this point, I am deeply steeped in conventional medicine. I'm running an NIH certified cancer program. Like I know how this goes. But I had a calling. I had some voice inside of me telling me that there was more. And I went home and I did the thing that I tell everyone never to do. I went on Dr. Google. Now, granted, this was 2016 and Dr. Google was far more reliable than Dr. Google is now, because Dr. Google has a narrative now that it not only do I not agree with it, but it's outwardly false. But then when I researched, I saw again and again and again, diet, 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 diet. And as a conventionally trained doctor, we are literally trained that what and how you eat and what and how you live doesn't matter. And so, we're not only not educated in that area, but we are told that we are intentionally not teaching you the things that are not important. So that is the message that we got in the totality of our education. And I have 11 years of higher education. So it was not seen fit to include in any of that time, but for 15 hours in my first year of medical school. And what they taught us were things that were ridiculous, that are just not seen in this day and age. We learned about rickets and, scurvy.
Mm-hmm.
We don't see that anymore. But that doesn't mean that we don't have tremendous deficiencies. And it doesn't mean that we're functioning optimally.
Mm-hmm.
So I decided to enroll in a coaching certificate program called the Institute for Integrative Nutrition. I researched, and I this kept coming up again and again and again. And I thought it was like an opportunity for me to dip my toe in the water. This could go on to become a master's for me if I decided to do that. And I kind of called them tirelessly and said, I've been a doctor for 20 years. Are you sure I'm going to learn something? Are you sure this is worth it for me? And they assured me, yes, yes, yes. And we have plenty of doctors in our program, and it's going to be really meaningful for you. Okay, okay. So I go to the first meeting, and a man named Mark Hyman walks on the stage. Now, again, 2016. I have no idea who he is. He walks on. He's this, tall, lanky guy, and he introduces himself as a functional medicine physician. And I thought, there's no such thing as a functional medicine physician. What is this quack talking about? And then I remember that I'm sick and I'm there for a reason. And I check my ego at the door, and I shut up and I listen. And thank God I did. Because within 3 minutes of him speaking, I know exactly why I got sick. I got sick so that I could be in that room on that day listening to him speak, because he is not only forecasting my path to healing, but he is showing me what the rest of my career is going to look like, because he opens my eyes to the fact that we in conventional medicine are focused on the wrong thing. We are focused on disease. And we know what we think about grows. So if all we do is focus on disease, that's all we're going to get. And all we do about that disease is manage symptoms. And if all you do is manage symptoms, all you're going to get is more symptoms, because the very thing that you're using to manage this symptom is going to cause another one. And then you're going to take something for that that's going to cause another one. And nowhere are we interfering with why we had the symptom in the first place. So we are, as a society, completely out of focus with what's important, with what should be. And so it took my getting sick to realize all of that. It took my getting sick to see all of that. And once I saw it, I couldn't unsee it. And so I'm an early adopter. I get really excited about things. And so that very day, I enrolled in the Institute for Functional Medicine. And I spend the next 3 years immersed in the study of functional medicine. And I get certified and I come out, and I just know that I can't stay in the system anymore, that I can't be a part of something that not only do I not believe in, but I know that ultimately I'm not helping people. I'm ushering them from one illness to the next, but I'm not changing the trajectory of their health. And so, my colleagues thought I was crazy. My husband said no. And despite all of that, I did it. And it was the best thing that I ever did. Because now I help people to truly heal.
Yeah. Your true gift, and living the truth is so important. And just to back up, I graduated from IIN as well,
Oh, you
So
did?
yes, that is my roots.
We're
And
good people.
we are. And, I totally understand because it is all about the whole system. And as we were taught, primary foods, secondary foods. I don't know if you
Yes.
remember all those terms.
Of course, I talk
I
about that all the time.
Yes, and it interweaves. It really is how we are as people because it does start with our mindset and how we're treating ourselves and speaking to ourselves, and that really does kind of project in how we live and
Yeah.
the choices that we make.
Yeah,
So
for
yeah,
sure.
I obviously studied there as well, and then I went on and did some more studying with the hormone health, which kind of helps support. It just kind of
Yeah.
circles
Did you
around.
also do that through IIN?
I sure did. I
Yeah.
sure did. And
Yeah.
the
One of my health
worst
coaches did that.
and I think it might have been the same year we were in there. I was 2016 too. So we were in the same class. That is so funny. It was a huge class. So obviously
Mm-hmm.
we didn't get a chance to meet at that time. But it came full circle for me, living with type 1, because I went years just thinking it was just, I was very resentful of it. I had a lot of bad incidences and low blood sugar episodes that really made me very bitter about having to carry this disease. But when when it came full circle, realizing there was more going on in my life that really did kind of impact what my day to day was, and in studying that, and now obviously working to help other women kind of reach that. And like you, I know now that this is my gift. I was we say struggles are tough, but there's definitely something good comes
Yeah.
from a struggle.
Yeah.
Disease, challenges is in life. So
Yeah.
we're both really
And,
good examples of that.
I wouldn't trade my experience as a surgeon in for anything,
Mm,
right? I mean, it truly is the greatest gift that God gave me because to have the opportunity to be with someone in that state and in that position and literally feel their trust in allowing you to care for them when they
mm,
cannot do anything for
for themselves.
themselves
Mm-hmm.
and to trust me literally with their lives
Mm,
is the greatest privilege. And I am so grateful to God for having given me that skill and
mm-hmm.
allowed me to do that. And I learned so much. So, when people talk about functional medicine and understanding how the body works and optimizing function, having been a surgeon, because I was a general surgeon before I was a cancer surgeon, having been a surgeon, I think it's almost impossible to really appreciate the function of the body
Mm,
without knowing the body to the nth degree, to every intimate part of it.
yeah. Yeah.
And I had that. I
Mm-hmm.
had that for 20 years.
Mm,
And there is nothing that could replace that.
mm.
That is an
Yeah,
invaluable
absolutely.
experience and
Yeah.
has given me the perspective and the wisdom that I have today.
Mm. Yeah. You bring up a point too, because a lot of what you bring to your practice in helping people is your knowledge of metabolic health. And, obviously diabetes, type 1, I think, and you might be able to maybe clear this or confirm this. Type 2, I believe, tends to be more of a metabolic disease based on lifestyle and all the different systems that are,
Yes.
the inflammation of sugar basically
Yes.
is what that driving. So I mean, I think of type 1 as metabolic as well, because, our body is not doing anything to help us with, the insulin production. So it's manually. So we're still having to treat our metabolic disease, even though it's an
Yes.
autoimmune driven
Yes.
disease. Does that make
So,
sense?
yes. So it's an autoimmune disease that has metabolic ramifications.
There's a good way to say it. Exactly.
And
Right.
as opposed to type 2, which is purely a metabolic disease.
Mm-hmm, mm-hmm,
And what complicates it even further is, insulin is a hormone,
mm-hmm,
right? And to have hormonal health, you have to have all the hormones in
mm-hmm.
balance.
Absolutely.
And
Yes.
for people with type 1, because of insulin's interaction with all the other hormones in the body, it is both complicated on the front end until you can figure out your way and find your pattern. And then it gets really complicated on the back end because as women go through menopause, they have huge metabolic shifts.
Yes.
And
Yes.
so it gets very complicated for the perimenopausal, menopausal type 1 diabetic.
Yes, I can attest to that.
And that's where,
Yes.
of course, right?
Mm-hmm.
And that's where we really need to focus on metabolic health and the things that drive metabolic health.
Yeah.
So, diet is the obvious one, but the not so obvious ones are prioritizing sleep.
Mm-hmm.
Because if you're not sleeping, it is impossible to have metabolic health.
Mm-hmm.
And sleep is also where the healing happens. And it's where the majority of our detoxification happens. Mm-hmm. So if you're not sleeping, those processes are not happening. Mm-hmm. The other thing that becomes of the utmost importance in the peri and postmenopausal woman is the maintenance of muscle mass. And this is especially difficult for people with type 1 diabetes. They struggle with this their whole lives. And it gets even worse in the peri and postmenopausal period. So, what happens there is a combination of things. First of all, to maintain muscle mass, you have to maintain protein balance. Protein balance gets harder and harder to maintain as we become less and less able to absorb and utilize our protein. Now, this is largely due to deterioration of our digestive tract, a decrease in the production of acid. We've vilified acid for the purposes of selling acid blockers. And in the meantime, created a population that is plenty sick because we need acid. We need acid to break down our food. We need acid to be able to absorb protein because we have to break it down to its lowest common denominator. And that's what, to the amino acids. And that's what acid does. It allows for that breakdown. It also protects us against infection. And it's these micro infections, not like a cold, not bad enough that you notice it, but these micro infections that are happening that are causing chronic inflammation, only making our hormone balance worse and only making building of protein worse. So acid production prevents the absorption of protein. And so then we can't maintain our muscle mass. And lastly, the way that we move really matters. So people tolerate a lot of cardiovascular activity in a premenopausal state. But as you get to perimenopause and menopause, that focus has to shift and you have to lift things that are heavy. You just have to. You have to maintain your muscle mass. And that's the only way it's going to happen. So the walkers and the runners and the spinners and the HIIT people, it's not going to do it for you.
Right.
And it's only going to increase your inflammatory load. And the more we replace our muscle mass with fat, the more problems we're going to have in achieving metabolic health.
Yeah. Yeah.
So
it can be such a vicious cycle too. You're bringing up some good points. I've been a weight lifter trainer my whole life. And I know that what has contributed to not only maintaining my bone density, my muscle, insulin sensitivity, because this is pivotal for us. And one of the things I hear the most, and I experienced this going through starting in perimenopause, I'm in postmenopause now, was insulin resistance, which was occurring. And I love the fact that you are confirming this because this is definitely things I've read and I've heard from other doctors as well. But I love the fact that we can talk about this with you. Yeah. It's ladies, we are not. You're not going crazy. It really does happen, and
you're not. Too, you are going crazy because that's what hormone withdrawal does to you.
Yes, that's true.
But it's not imaginary.
Right.
Let's say that.
Right.
But yeah, I had many a moment and really, really grappled with what I was going to do. But I am a huge believer in bioidentical hormone replacement.
It's definitely
Um,
something I want to talk with you about
we,
more. Definitely. Uh-huh.
yeah, so, we were really not as humans, we were not meant to live as long as we're living in this environment,
Mm,
right? And so if if you lived a long time as our generations and generations and generations ago,
mhm,
it was because you never had one of the many illnesses that we didn't have any medicines for,
mhm,
or you got eaten by an animal or killed in some tragic accident.
mhm,
But we did not see the metabolic diseases then that we have now.
mm,
And so if you are going to live well past menopause, what happens around that time is kind of a rapid deterioration of your body. It's a rapid deterioration of your heart health. It's a rapid deterioration of your bone health. It's a rapid deterioration of your brain health. But we have the opportunity to prevent that.
mhm,
And largely, I mean, if we were talking 20, even 25 years ago, most women went on hormone replacement.
mhm,
They did. It was readily prescribed and um, readily available, and people really benefited from it.
mhm,
And then came the Women's Health Initiative,
mm,
and with that, and they say their entire goal was to stop the runaway train of hormone replacement.
mhm.
That was the primary
Wow.
investigator's goal. He has said that. He stands by that. I mean,
Mm,
that was his goal. And so without the consensus of all the investigators, without the input and without proper data, they halted that study and released the statement that hormone replacement causes breast cancer.
mhm.
It has since been retracted, and no one is able to unring that bell. And so
Exactly. Yeah.
decades of women have suffered unnecessarily. I just reviewed all of this because I'm presenting on it at A4M in Las Vegas next month. But suffice to say that estrogen for sure does not cause breast cancer. Hormone replacement doesn't cause breast cancer, although I do think that we should make the distinction between synthetic hormone replacement and
Mhm,
bioidentical hormone replacement because I
mhm,
think that they are different.
mhm,
And if you are going to replace, I do recommend that you replace with something bioidentical because that means that it's the same chemical compound and therefore acts the same as our endogenous hormones would work.
mhm. Okay. Mhm,
If you are to get breast cancer while you're on hormone replacement, just like people get breast cancer when they're not on hormone replacement, as it turns out, the people that are on hormone replacement when they get breast cancer have a better prognosis and do better. And that's because they are overall healthier.
mm,
And if you've had breast cancer and you are now in menopause, it was originally believed that you would be at increased risk of recurrence. That is not true. We have not seen that borne out in the literature. And again, if you do have a recurrence and you're on hormone replacement, you have a better prognosis.
very good.
So for me,
Mm,
I think that in the right person and the right way, I firmly believe in hormone replacement in the perimenopausal woman, in the menopausal woman, and in the woman who has recovered from breast cancer.
mm. Something I hear as well, this comes from a conversation I just had with a client. There's the fear. This is the same fear that you were talking about, the World Health Organization just kind of put out there. And it's hard for women to let go of that. And then they see women in their family. And in most cases, it's a mother, it's an aunt that experienced this and they don't want to experience it themselves.
Mm-hmm.
But what about what do you think with as far as I'm gonna jump over to mammograms, and because that's one of those things that's very much touted as the absolute, you must get those yearly those annual mammograms.
Of course, it makes a lot of money for the system.
It keeps the engine going, doesn't it?
It does. And it's a big engine.
Mm-hmm.
That's a big engine. Yeah.
And you posted, if you don't mind me throwing this in there, you posted on social on Instagram, and it was a post that got a lot of attention, and it was why, or 5 breast cancer myths, and one of it is that mammograms don't, and I hope I don't mess this up. Mammograms don't prevent or save.
They don't save lives.
Yeah, they don't
save lives. I know there's been a really great ad campaign that says that they do, but the facts just don't bear that out. And in fact, when we break people up into cohorts of 10,000, for every 10,000 women we screen, we'll save one woman's life, potentially. I could argue that too. And we'll cause 7 breast cancers. We're going to cause 7 breast cancers for every life we save. And every mammogram you get increases the risk that you're going to get a breast cancer.
Yeah.
So let's say we have someone with a BRCA mutation, a mutation that makes her more likely to get breast cancer. In fact, the numbers are somewhere around 86 or 87% likelihood of breast cancer in your lifetime. And we take these women and we start them early on screening. And we are basically guaranteeing that they are going to get breast cancer, because we're taking someone who the BRCA genes are tumor repair genes, DNA repair genes. Okay. So we're taking someone who already struggles with DNA repair and giving them the very thing that damages their DNA and then giving them breast cancer. So
interesting.
Yeah. And, for the average person, maybe you're slightly increasing their risk. But remember, these studies, like all the technology that exists now, the 3D mammogram, that was grandfathered in. There were not safety studies for that. There were non-inferiority studies. We showed it to be better than a 2D mammogram at detecting malignancy, but we didn't test it for safety because the safety's already been established. But, when the mammographic screening program was established in the 1970s, it was established with the following premise. Breast cancer is linear and predictable. So the thought was that if it starts really small and grows to some critical size, at which point it's more likely to metastasize, if we find it along that path before it's hit that critical size, then we can prevent deaths from breast cancer. And it's a lovely theory and it's very logical, but it's also not true. And so breast cancer is neither predictable nor linear in its growth. And there are very small cancers that have aggressive biology that will behave aggressively, and very large cancers that don't have aggressive biology that won't behave aggressively, and everything in between. So no matter how many mammograms we do every year, the same exact number of women die of breast cancer every year. Now, do we treat more breast cancers? Do we find more breast cancers? Yeah. But we find breast cancers that don't need to be treated. We find breast cancers that are not going to progress, that are never going to become anything. Most of them are probably radiation-induced breast cancers.
Interesting.
And no matter how many mammograms we do, the exact same number of women present with aggressive disease every year. We are not impacting the bottom line. We are creating a lot of business. We're creating a lot of customers, but we are not saving lives and we are not
Mm.
impacting the bottom line.
So what would you say influences a woman's chance of getting breast cancer?
Yeah. So breast cancer is an environmental disease and a metabolic disease. That's what's happening. And,
Mhm.
we think of breast cancer is as a foreign invader, right? But
Mm.
it's not. Your breast cancer is a part of you.
Mm.
Your breast cancer is the part of you that is saying, this is not working for me.
Right.
I don't like what's happening here. There's been an environmental shift that is
Mm.
making me feel threatened, and I'm going into survival mode.
Mm.
That is exactly what's happening. And we can actually measure the pH of the surrounding tissue around a breast cancer, and it's different.
Mm.
So, the breast is comprised of 4 tissues. It's the glandular tissue, fat, connective tissue, and a skin envelope that holds it all together. The breast, even in dense breasted women, the breast has a lot of fat in it. It has a lot of fat cells. And it's in the fat cells where we store our toxins.
Mm.
So the more toxins you come into contact with, the more likely it is that you're going to get a breast cancer because those
Mm.
toxins are being directly stored in the breast tissue.
Mm.
And these toxins have direct influence on the cells, and they can directly damage the cells, directly damage the DNA of the cells. And this is where cancer cells come from.
Mm-hmm.
Now, the other part of it is that an intact immune system should be able to recognize those cells and destroy them in their infancy and not allow this to progress to a point where it is life threatening.
Mm.
But our immune systems are tanked. They're
Mm-hmm.
tanked because they're busy fighting, they're busy on an autoimmune journey, right?
Mm-hmm.
I mean, look at how many women have autoimmune thyroid disease in this
Mm-hmm.
country, nearly a quarter. So, if your immune system is doing that, or if your immune system is busy worrying about gluten or dairy or pesticides or herbicides or fungicides
Mm-hmm.
or chronic viral infections or mold or um, deadlines,
Yeah.
difficult relationships,
Mm-hmm.
childhood trauma, recent trauma, a death in the family, if you're a sick child, if your immune system is busy in that space, it is not going to be able to defend you against a breast cancer.
Yeah.
And the majority of us have immune systems that are highly distracted from what they're supposed to be doing.
Mm.
And
Yeah.
this is why functional medicine is so important,
Yeah.
because functional medicine is looking at the why and trying to figure out why your immune system is not doing what it's supposed to be doing and helping you to get your immune system to come back online.
Mm.
And at the same time, creating metabolic health
Yeah.
because it's what we have to do. We have to find that harmony.
Yeah. It comes back to the basics, doesn't it?
Yes, it does.
Yes,
It
yes.
does.
Yeah, and breast cancer is obviously a disease, and like all disease, and it's a symptom of just like what you said,
Yeah.
your body's screaming,
Yeah.
this is not right. I'm out of balance. I need help. I need nourishing. I need balance,
I
right?
need attention. I
Yeah,
need
yeah,
love.
pay
I need
attention.
tenderness. I
Mm-hmm.
need kindness. That's what
Yeah.
your body is saying, which is why I'm very careful to not use words like fight breast cancer.
Mm.
And because the last thing your body needs if you have a breast cancer diagnosis is a fight.
Mm.
Your body needs a hug. It
Mm.
needs love. It needs attention. It needs care. It needs touch,
Mm.
but it doesn't need a fight.
Mm. Yeah, I love that. Really good. So, mammograms, I'm going to get back on mammograms. What are alternatives? And this is actually very timely because I just got my notice in the mail that my annual, because up until now, I've been doing my annual. And since I have been paying closer attention to both you and to Dr. Tabitha Barber, who was on an earlier episode here, and you two had an episode, it was on your show, Keeping Abreast, your podcast, and she came on, and it was the truth about estrogen and breast cancer. And I will tell you, I cannot tell you how many friends, clients, women I have shared that episode with. And I told them all, every woman needs to hear these two ladies. It was the most impactful, and it was such a easy to listen to episode. It was applicable.
She's
And
amazing.
yes, I loved it. And I appreciate you two strong-minded, educated women coming and inspiring us with the truth. And it's just,
my husband would add annoying into that
list. Sometimes annoying kind of helps, though. kind of helps to kind of move the needle to the right direction, right?
Maybe overly persistent.
Like I was saying, my mammogram is coming up, and I am reconsidering making that appointment.
Yeah.
And so what are my alternatives?
Yeah.
What are my alternatives?
Definitely reconsider, because it has been proven time and time again, which is why countries around the world have abandoned the mammographic screening program, because mammograms do not save lives. They do not save lives. I'm going to say it again and again and again and again and again. They do not save lives. There's no benefit to getting a mammogram. None, nothing, none. I do, at the same time, think that you should know your body and know what's happening with your body. So I believe that everyone should be doing self-breast examinations. If you are premenopausal, if you're still cycling, then you should do it 1 week after your cycle starts. That's when the breasts are the most quiet. If you're postmenopausal, feel them on the first, right? First of the month. And if you know what your breasts feel like normally, you will know when there's been a change.
Right.
And, a proper breast exam involves looking at your breast, making sure that you don't see any lumps or bumps, but also raising your arms above your head, looking at the color. You're looking for redness, you're looking for lesions, and you're also looking for some skin retraction, because cancers will do that. They'll pull in on the skin.
Okay.
And then either if you're small breasted, you can do it in the shower. If you're larger breasted, do it lying down, put some lotion or powder or something on your hand to get rid of friction. And then go radially around your breast using your fingertips. Go radially around your breast. And if you feel something, it's going to feel like a bump in the road. And if you feel something, that's the time to get it evaluated. And I have no problems with using mammograms and using ultrasounds for diagnostic purposes, right? When you feel something. What I object to is subjecting people to a screening mammogram year after year after year, and sometimes twice a year. I mean, plenty of people are getting called back for additional views, and then they want to see them again in 6 months. I mean, this is the hamster wheel that many, many women are on for years. And so for me, I'm not throwing the baby out with the bathwater, right? I'm all in favor of using it for diagnostic purposes. I just don't think it has any role in screening. Now, if you absolutely want to do screening, I have 2 options for you. The first is what is going to replace mammogram and MRI, and it's called QT imaging. This is novel technology that is unlike anything else that's out there. It is safe, it's painless, it's fast, it's comfortable, there's no radiation, it's affordable. It's FDA approved. And it's FDA approved to screen the population that needs it most, the dense breasted population. But anyone can use it for screening. And currently there are 5 centers open, 4 in California and 1 in Scottsdale, Arizona. I am working on bringing them to the East Coast. And I'm hoping within the next 5 years, they'll be universally available. That is my goal, to make sure that those imaging centers are universally available. If you absolutely have to have a study right now and you can't get to California or Scottsdale, I think you can have a screening ultrasound. I think that's fine. Is it going to pick up everything? No, but it's certainly going to pick up the stuff that's important that needs to be picked up.
Okay.
And so that's kind of my feeling is the things that are meaningful, that need treatment, that need attention, they're going to come to our attention. And I don't think we need to go looking for them.
Mm. Yeah.
And again, we are not saving lives by finding these tiny cancers.
Mm.
Because if that were true, then the overall number of women that die of breast cancer every year would change. But it doesn't.
Mm.
It doesn't.
Mm. No, no. Yeah. It's really about preventive health. You just said, we need to be paying closer attention to how we're feeling, looking closer at the inflammation,
Yep,
those other symptoms that could lead to other disease, like breast
absolutely.
cancer is an example. It's another reason for us women to put ourselves and our health first, and not rely on things like mammograms. And another thing that comes up a lot, especially now in this time of our life, is bone density. And those screens are just as dangerous. And there are some other ways to get our bone density tested. And I don't have that name written down because I wasn't planning on.
Kevin Ellis,
Yeah,
the
it's
bone coach. And
okay.
that episode that I did with him
Okay,
is
awesome.
invaluable. So
We'll link to that. Yeah.
if anyone wants to hear about bone health and the whole DEXA scan controversy and
Hmm.
why it's out there, I did an awesome episode with Kevin Ellis, who is the bone
Okay.
coach, and his website is thebonecoach.com. And just give a listen to that episode because any woman should be concerned about bone health and
Hmm.
listen to that. But part of the reason why the Women's Health Initiative was so intent on getting people off of hormone replacement is because when you get them off hormone replacement, their bones deteriorate, their
Hmm.
brains deteriorate,
Hmm.
and their heart deteriorates. So they have the opportunity to put them on statins, to put them on bisphosphonates, to
Yeah.
put them on antidepressives, to put them on anti-anxiety medications, to put them on memory medications.
Mm.
So they outright said, why should we put women on hormone replacement when we have all of these other options? And that they would much rather have you on 5 medications than one.
Yes. And the average
And
person is on that. Yes.
and given the fact that, you can't patent estradiol,
Mm.
like they can't make any money off of that.
Hmm. Yeah.
And so they're going to make a lot of money in convincing you that you need this medicine for your bones, this medicine for your brain, this medicine for your heart. And for them, it's a win-win.
Yeah.
The only
Yeah.
person that loses is the patient because
Hmm.
those medications are dangerous and they don't work.
Hmm.
They don't
Yeah.
work.
Yeah.
And in
Yeah. It's
fact,
yeah. Yeah.
women
Temporary help,
on,
isn't it?
well, it's not even temporary help because, we can go down the line of all of those.
Mm.
Women on statins have a 63% increase in risk of developing diabetes.
Mm.
Why on earth would you trade that in for diabetes?
Hmm.
Right? And, we vilified cholesterol. Cholesterol is a very protective molecule. We need
Hmm.
cholesterol.
Hmm.
Cholesterol is the base to our hormones, it's the base to our neurotransmitters. We can't make a cell without cholesterol because cholesterol makes up the cell wall. Our brains are mostly cholesterol. So if we lower that cholesterol, have we really helped people? Because we know when you look at the population that turns up in the ER having a heart attack, 50% of them will have normal cholesterol. It's not the cholesterol. That's not what's happening. Now, I am not saying that there are not familial hypercholesterolemia syndromes. There are people who, because of their genetics, are walking around with cholesterols in the 500s.
Mhm.
These are not the people that I am referring to. I mean, basically, their blood is fat. They need help. They need statins. They
Mhm.
need high dose statins. They probably need more than that. It's not my area of expertise.
Gotcha. Yeah.
However, the woman walking around with a cholesterol of 220 or 230 or 240, I'm like, great. You have a higher chance of survival.
Mhm.
No one talks about that.
That is so interesting. Yeah. Yeah.
So,
Yeah. Gotta
you
gotta
know, and
understand the use of all of this. Yeah. To be able to put
yeah,
the puzzle
and
together. Yeah.
we could talk about what's happening with the bisphosphonates because yes, are they making the bone thicker? Yes, they are preventing remodeling of the bone. But all that means is that that bone that's damaged that should undergo remodeling is not undergoing remodeling. So now what's happening? We're getting fractures and we're getting
Mhm.
bad fractures because
Mhm.
if you're not allowing for that bone to remodel, the bone is becoming more and more brittle. We
Mhm.
have to have some flexibility, some elasticity of that bone to prevent fractures. And
Mhm.
when you go on the bisphosphonates, you lose that flexibility
Mhm.
and you're not repairing your bone. So what happens? Fractures.
Fractures. Yeah.
So,
Yeah.
if
So
we are
common.
not
Yeah.
saving people from the very disease that we're allegedly preventing with these medications, what are we doing?
Mm.
What are we
Mm.
doing?
Mm.
We need to get back to hormone replacement
Mm.
because estrogen is the hormone of life and things don't work when there's not estrogen around. And anyone who has been treated for breast cancer and has been put on an aromatase inhibitor will tell you all about that. Will tell
Mm.
you about the depression, the word searching, the
Mm.
forgetfulness, the brain fog, the lack of libido, the sadness.
Mhm.
And at the same time, they get a tire around their middle,
Mhm.
weight gain, they all their joints ache, they're
Mhm.
uncomfortable. And this is no way to live.
Right.
It's
Exactly.
no way
Yeah.
to live. And if
Mhm.
we are going to save people from diseases, we ought to give them a life worth living.
Mhm. Mhm. Yeah. Yes. And proper education, this is which is what I love what you're doing. You're helping informing us of what we should be asking, what we should be talking to the doctor about,
Yeah.
because in a lot of cases, there is a pushback, when we come in and we're told. Another thing that you and Dr. Barbara brought up was the lack of testing. So we're pushed back, they won't even. Some of them will. Obviously, you got to find that doctor that's willing to do those hormone tests, and sometimes it doesn't
Most of them
even.
won't,
Yeah, no,
probably
yeah,
because they don't know how to read them.
they don't know how to read them exactly. So that's
Mhm.
the fear, right? So
Yeah.
yeah. So then we're talking about just the ego behind
Yeah.
that. Well, I could
Yeah.
test it, but I'm not quite sure what the next step should be for you.
Yeah.
So I'll just avoid
Well,
it. Yeah.
and what's happened, Tabitha and I have spoken about on many occasions was it has to start with education. And
Mm-hmm.
we have to start educating our youth. For
Mm,
people in medical school, they should be learning this. They should be
yeah.
learning about functional medicine. I'm taught all the biochemistry in the first year, and then they tell me to stop thinking about it and stop using it, right? Don't think
Mm,
about that anymore.
mm,
And we're just not educated.
yeah.
And it takes a really driven person to it. I left medicine, I left surgery at the height of my career and
Mm,
went back to school. How many people are going to do that? Right. And
mm-hmm,
it's work that should have been done in the beginning.
mm-hmm,
It should be part of our medical school education so
mm-hmm.
that we can truly heal people. But the problem is our medical school education is funded by pharmaceutical companies
Pharmaceutical. Mm-hmm.
and they don't want
Yeah.
it. They
Yeah.
don't want people to be
Yeah.
healthy.
Yeah. Yeah. Yeah, we have to advocate, and I appreciate that. So if you were to give our listeners, you've given them a lot of good nuggets today. I appreciate you. Some tips to prevent, obviously, not only breast cancer as we spoke into, but
Yeah.
all disease.
Yeah.
Just a few things, some takeaways, and maybe if and when they have been maybe diagnosed, and that those treatment options. There's
Yeah.
a lot of different
For
steps,
sure.
depending on the woman and where she is.
Yeah. Well, no matter where you are on your breast cancer journey, I wrote a book. It's called The Smart Person's Guide to Breast Cancer. You must read it because it's the answer to the questions that you're asking. I also have a course called My Answer to Breast Cancer that is available online. You can do at your leisure, and that also provides a tremendous amount of education and support and answers for you to be able to formulate a plan. But at the end of the day, we have to remember that breast health is health. And the
Mm,
same things that you're going to do to create healthy breasts are going to create a healthy heart, a healthy brain, healthy bones, healthy gut, healthy lungs. Like
mhm,
it all goes together.
mhm,
So what I tell people is that, we have the foundation, the pillars that actually hold our health. And this involves eating in a way that is nourishing, that is right for you. Me personally, I advocate for a plant based, whole food, grain free, low glycemic diet because I think that that is the one diet that is going to be right for everyone. And we can debate all day where you get your protein from.
mhm,
And for me, this isn't about religion. I mean, for me personally, it is, but but
mhm,
it in the scope of things, like it's not about religion. It's about what is right for you. And
mhm,
there are some people, like if you're an O blood type, you probably really do need to eat meat. And if you're an A blood type and agrarian, you're fine on a plant-based diet. You can
mhm.
do really well. Um, the B's are a little more confusing, but
Yeah.
getting on that nourishing diet that's right for you, having healthy ways to manage stress. We live in a world of never ending deadlines, priorities.
Mhm,
There are roadblocks everywhere. Like you're never getting rid of the stress. The stress is going to be there and ever present. We have to have healthy ways to deal with it that aren't alcohol, that aren't pot, that aren't drugs. We
mhm,
have to have healthy ways to deal with the stressors of life. You have to have movement. We are meant to move. If you do not move your body, you lose it. And
mhm.
anyone who has sat in a chair all day knows, right? You get up and you feel like a 90-year-old woman because we
Absolutely.
have to move our bodies. We have to maintain our flexibility. We have to maintain our balance. We have to maintain our strength. And the
Mhm,
only way to do that is to use your body.
mhm.
Um, we have to prioritize sleep.
Sleep,
We are a
sleep, sleep. Yeah.
society that
Mhm,
that only values the waking hours. And as a result, we're sick. We're really
mhm,
sick.
mhm,
And much of that disease would go away if we would sleep at night. And that is further compounded with how many electronics we surround ourselves with every day.
mhm,
And we are literally poisoning ourselves. We are overstimulating ourselves. We are consuming way, way, way too much of the electromagnetic field. And we need to stop that.
mhm,
So, turning it off. Um, the rest of the toxins that surround us are really damaging our health. Many of them are xenoestrogens. They are things in our environment that act like toxic estrogen, and they are largely contributing to breast cancer.
mhm,
So, being as mindful as you can, deplasticizing your life, avoiding
mhm.
antibiotics and food that has antibiotics.
Right.
Stop with all the like antibacterials and stuff like that. Stop sanitizing. We need more germs in our life. We have to inform our immune system, and
Yeah,
that's the only way it's going to happen.
yeah, yeah.
So,
Really good point.
stop
Mhm,
sanitizing your life, but also, get rid of the nonstick, get rid of the plastics,
Yeah.
that kind of thing. It goes a long way.
Mm-hmm.
And lastly, living with connection and purpose.
Mm-hmm.
We are all put on this earth for a purpose,
Mm-hmm.
and it doesn't have to be, everyone doesn't need to change the world. And my purpose isn't your purpose, and your purpose isn't my purpose, right? And maybe your purpose is to raise amazing humans. Great. We need more amazing humans on this earth.
Mm-hmm.
And, I have been focused on my career for my entire adult life. And I think about it now, and I pray that I'm raising amazing humans, but I
Mm-hmm.
don't know. I just don't know.
Gotcha. Yeah.
And
Yeah.
so,
Yeah, that's an important part too, just to do a
yeah,
self-check on
yeah. When
where it is and where our
just
heart lies.
exactly, just sit
Absolutely.
with
Yeah.
yourself
Mm-hmm.
and ask, like, what is important? What are you here
Mm-hmm.
for?
Yeah.
And do that really well and with
Mm-hmm.
great meaning. And have those strong social connections. We are social beings,
Mm-hmm.
and no one can do this alone. You won't
Mm-hmm.
survive. And and in the end, this is about the journey and making this journey as meaningful as you can.
Mm. I love that. Thank you so much.
You're so welcome.
Thank you so much for being here and spending time and explaining the different layers of breast cancer, metabolic health, and how they pertain. We didn't unpack diabetes too much today, which is fine because I think we talk about that a lot on this show. But it's the same woman that's listening to this show,
Yeah.
and diabetes is going to be in blood sugar, and all of those things that we have to monitor are impacted by everything that you mentioned.
Yeah.
And
Well,
it's
to that point, I do want to say that in functional medicine, we know and recognize that people are losing their metabolic health
mm,
long before they know.
mm,
And there are people walking around with hemoglobin A1Cs in the mid fives, and their doctors are saying, this is fine. And it's
mm,
really not. That
mm,
is the path to diabetes.
yeah,
And so everyone should know that your fasting glucose should be below 90.
mhm,
Your fasting insulin should be between 2 and 5.
mhm,
And your A1C should be below 5. And if
mhm,
it's not, you need to figure out why it's not.
yeah,
As women transition through menopause, that gets harder and harder
mhm,
unless you go on hormone replacement,
yeah.
because estrogen is very tied to your ability to balance your blood sugar.
It sure is. It
Hmm.
sure is. It
Yeah.
saved me. Yes, I'm very happily on hormone replacement.
Yeah.
So
It makes a huge,
it was that missing
huge
piece.
difference.
Yes,
Hmm.
yes. And I'll never
Yeah.
look back. So very thankful. Thankful for the information and thankful for doctors like you. Dr. Jen, thanks so much for
It's
being
my
here.
pleasure.
And how can our listeners find you? I know we mentioned a few things. We're going to connect all this in the show notes because
Great.
you've got so many things for them to
I have
stay
a lot of
connected with you.
things for
You
sure.
do.
So, I think we have a free giveaway for your listeners. It's the
Nice.
Breast Owners Manual. So you'll have that. My website is Real Health MD.
Mhm.
And we have lots of information there. I have a podcast that we mentioned a couple times here called Keeping Abreast with Dr. Jen. I also have a Facebook group with the same name that if you want to ask me questions or ask my community questions, there is great, great, great discussion there. And I'm really proud of what's happening inside of that group. Um, for anyone who has had breast cancer, my book, The Smart Person's Guide to Breast Cancer, is an
Mhm.
invaluable resource. And you can find me on social media. I'm
Mhm.
on all the social media platforms at Dr. Jenn Simmons, and my Jen has two N's.
Mhm.
And then lastly, look for my imaging centers, which will be opening in this next year all across the East Coast.
I love that.
Yeah.
You've got something going on. I love it. And
I for sure do.
Yeah, I love it. There's always more for us to do, right? And for the right reasons. So I appreciate you. Well, thanks again.
Thank you.
And like I mentioned, I will link all of Dr. Jenn Simmons' information here to stay in contact and to reach out. And I think those books that you mentioned, the two that you mentioned, would be great resources. So for the women that need to get some answers for some things happening with their health and their breast health. So thanks again. And we will be back in here next week. And please share this show. Please share this show. Women need to hear Dr. Jenn, and they need to know this information. We are here to inform and to empower women living with type 1 diabetes. And enjoy the rest of your day. Thanks again. Thanks for tuning in to the Type 1 and Midlife podcast. And be sure to subscribe, rate, and review right here on iTunes. And you're invited to connect with our Type 1 and Midlife community on the free Honey Health app. Here we discuss the podcast topics in a group chat, a chance for you to ask questions and take action on what we share here on the show. You can find the app link to download for free right here in the show notes. And for free resources, you can visit me at abundanthealthwithmelissa.com. And your support means so much. Thank you.